Hi, my name is Jen Crombie. I'm one of the lymphoma physicians at Dana-Farber Cancer Institute in Boston. And I am grateful to have had the opportunity to participate in the ELM-1 study, which is a phase 1 study of the CD20, CD3 bispecific antibody Odronextamab in patients with relapsed or refractory diffuse large B-cell lymphoma. And this year at ASH, we're seeing the results of this drug in an expansion cohort of patients with diffuse large B-cell lymphoma, all of which who had been previously treated with CAR T-cell therapy, which we know is a very high risk and difficult to treat patient population. So in this study, all the patients had received prior CAR T, and on average, they had received the CAR T about 6 months prior to receiving the bispecific antibody. And what we saw was that the drug was active in this patient population. Just under half of patients had a response to therapy, and just over 30% of patients had a complete response to therapy. And among those patients who did respond, we're able to see that they can maintain their response. So the median duration of response was almost 15 months. And if the patients had a CR, we're not seeing the median duration of response being reached yet. So that's very promising for this difficult to treat patient population. One of the major risk factors of this type of therapy is a side effect called cytokine release syndrome, or CRS. Odronextamab is the risk of that is highest when initiating the drug. So Odronextamab is administered using a step-up dosing schema to try to decrease the risk of that happening. And with those dose changes, they saw only about 50% of patients had the CRS, and it was mostly low grade, meaning not very severe. So that's also encouraging. So there are a few other bispecific antibodies that are already available for patients with relapsed refractory diffuse large B-cell lymphoma, and we'll see if this becomes another treatment option available for patients, particularly this post-CAR T-cell patient group.